Hello, everybody. I'm Al Tartaglia. I'm a precinct chair with the Hancock County, Indiana Democrats, and we tried to do something different right now. We are going to try to do this type of podcast where right now I'm taking the lead, and we're going to talk about topics and issues that impact our county. And for our first episode, I want to start with healthcare and SNAP because, you know, of the big, beautiful bill. I want to start with, I used to be very Republican on this issue growing up, and I was young, I was healthy. I never got health insurance. I didn't get it till I had my kids, and I only figured I needed to get it because, hey, kids will get sick. It might be a good idea. Then I was fortunate enough to take a job in Germany. And I got to see how the other people in the world get to live. And I remember asking my German coworkers, how does it work here? What does it do for you guys? And they're like, we just go to the doctor, we get a prescription, and we get our medication. They don't even pay for medication half the time. I remember my coworker was getting a brace for his knee, and he said, I get to pick it out of this book, and they send it to me. There's no copay, no nothing. And I remember at the time, my ex-wife had basal cell carcinoma, and I had insurance through America still, which covered me overseas, but I'm sitting there calling the company, trying to find out what is my deductible, what is my copay going to be, what is it going to cost me out of pocket. Granted, basal cell carcinoma in her instance was not a life-threatening surgery, but I thought to myself, why is that something I need to worry about when I should be worried about what's going on with my spouse at the time? Then, you know, we come back to America, and my son is on a medication that the doctor prescribed him. My insurance, fortunately, is good, but the insurance rejected it. I had to call, find out why it was rejected. Then I had to call the doctor's office to tell them why so they could fix it. Then it got approved. Then the specialty pharmacy had to do an approval of their own. And I'm like, well, my insurance already covered this. Why are we doing this? And I was just spent 3 days on the phone. It was frustrating. So now that I see what's going on with this bill, it's concerning to me. And let me start off with some of the language they're using. The people in the Republican Party, the leaders, not all, the leaders right now, they like to use dehumanizing language to make us see these people who use these services as less than. And what I mean by this is they use comments like welfare queens, able-bodied adults who won't work, people living off the government. They call it a dependency culture. Then they go, I have my notes. Let me look at my notes. I wrote things down sometimes. They have things of they're casting as a burden the taxpayers. They're living off the back of hardworking Americans. Taxpayer-funded handouts, unsustainable entitlement spending, non-contributors, recipients, enrollees, welfare cases. Then they say welfare fraud, people gaming the system, illegals abusing Medicaid. Illegals don't get to get Medicaid. Let's get that there, right there. We've had the president say people on SNAP just don't want to work. You've had the governor of Florida say he's opposed to welfare programs. We're not going to run Florida into a welfare state. Using these language makes you think less than these people, and it actually causes people who qualify for these programs not to get on them. I'll come up and say it. When I was a kid, my parents were on food stamps for a little bit. I remember it. I remember back in the day, this is in the 80s, where you had the coupon book with like the Monopoly looking money, and now you guys get cards. And I'm grateful for my country for helping me out at the time, because I've got to the point where I don't have to rely on those services. I'm able to provide a good life for my family. But because my government was there for me when I needed it, as a kid especially, I'm able to get where I am now. So that said, they're using language to pit. It's us versus them. They want the people to think, well, I'm paying my taxes, I pay my bills. Why are them over there are not? And they're just taking from the system. it's not as simple as that. And then you have the Speaker of the House, Mike Johnson, say the other day, well, we have these kids playing video games in their parents' basement getting Medicare. I cannot think of anybody who plays video games all day, cares enough about their health to go sign up for Medicaid. Again, as a young adult, I was healthy in my 20s when I wasn't in the Army anymore. I didn't get health care because I go to the doctor 3 days a week. It wasn't worth it. So I wasn't going to sign up for Medicaid. You have these kids supposedly living in their parents' basements, are not signing up for Medicaid. So they're making these things up, again, to make you look down on people using these things. And then again, that scares more people off. I have more of my notes here. So again, it goes back to, why does this language matter? It creates stigma and discourages people from seeking help, dehumanizes and oversimplifies complex individual circumstances, justifies harmful policy cuts. And that's important. You're saying, I pay my taxes, I have my health insurance for my work, I don't care about these people losing something that's helping them. It ignores the fact that most recipients are children, seniors, disabled, or working poor. A lot of people who are on these benefits are people working the remedial jobs that we don't do. Somebody has to do it. I've done those jobs. I've been poor. I don't see why we're getting so worked up on people getting help. We're supposed to help our fellow human beings, our citizens. And again, when you dehumanize people and you make it easier, again, for us to say we don't need to help them. They don't deserve my help. But that's not how it should be. I'm not the arbiter of who should get, who should not get these programs. We have our Senator Jim Banks, who would probably say with his little picture of himself, they probably deserved it. Like he told the person who lost their job, is the mentality we have going on in Washington and with these politicians. They probably think these people deserve it. They don't. So we'll go with some more statistics here. Over 80% of the people who are on SNAP were working the year before they got on it. So they were working. Most of them, again, like I said, work in low-wage, unstable jobs, food service, retail, gig work, where it's hard to have a consistent income. Again, Medicaid, 61% of the people are working on Medicaid, 30% are not working due to caregiving, school, health issue, or job searches. Only 9% are not working without documented reason. And that 9% I have not been able to dig into further, but that is not why we're broke. That 9% are not the reason why this country is failing to pay bills properly. We have to cut taxes here for the rich, raise it for the poor. That's not why we're poor here. We're not doing this right. And again, this is my first time doing this, so I'm going to have some word stumbles, I'm sure. I want to be as authentic as possible, though. I don't want to do a lot of edits. I just want to get a simple message across. And that's what I'm trying to do. And I plan to keep these 15 minutes or less. I don't think you want to sit here and hear me talk for 15 minutes. And I think most people's attention span isn't more than 15 minutes nowadays. So if the cuts that they are proposing in the big beautiful bill hit, they'll hit nationally, obviously, but we're in Hancock County. So let's talk about how that impacts Hancock County itself. So the first year estimate cost of SNAP benefit funding loss is $680,000 a year. That's for the first year. Medicaid funding loss to Hancock County is going to be between 12 to 18 million. The local economic activity from SNAP spending is going to be 1.25 to 1.3 million per year. Because remember now, they were using the food stamps, the SNAP benefit, to help buy food. It's that let them have money to free up to spend other places. If you're going to reduce the benefit, and you're reducing for mainly kids, a lot of kids are on these programs, the parents have to make up the money somewhere else. So it's going to come out of the budget they spend around the community. They might not go to that shop to buy something from a small business as often because they're putting that money towards the food they need. All right. There's going to be increased healthcare costs, 1 to 2 million a year, and other indirect costs going to be 0.5 to 2 million per year. So in the first year in Hancock County alone, it's going to be an impact of 15.4 to 22.3 million dollars. So so if this goes for 10 years, it's going to cost Hancock County a loss of SNAP benefits between 6.8 to 7.3, Medicaid funding losses 120 to 180 million a year. Lost economic activity from SNAP spending, 12.5 to 13 million over 10 years. Increased healthcare costs, 10 million to 20 million over 10 years. Other indirect costs, jobs, nonprofits, schools, is going to be 5 to 10 million over 10 years. That brings us up to 154 to 230 million dollar economic impact. Now, you remember, on top of that, people who are losing their health insurance are not going to not see a doctor when something happens. People will utilize the emergency rooms. That will drive costs up for all of us too, because these hospitals do not work for free. They're going to need to get money somewhere. We will see that, I believe, in increased premiums, increased deductibles, increased drug costs possibly, increased wait time. So when you do have an emergency and you go, you're going to have more people in the ER now, because that's the only place they can get treated, because legally you cannot be turned away from the ER. So we are in a position where the people who we have chosen to lead us are looking out for the people who've given them money and have paid their bills and who have donated to their campaigns. They do not seem to care about the others. They want us to fight with the others over the scraps they're going to give us. And they get more power from us when we do that. When we fight against our common man, woman, human, we're not focusing on what they're doing to us. Again, SNAP, Medicaid, Medicare, these programs are not the reason why America has a deficit and a debt issue. Now remember, the deficit is your deficit is what you overspend every year, and the debt is a cumulative total of all those deficits. So now, if we can give tax breaks to people who don't need it, now remember also, after the first $65,000 you make a year, every dollar after that, you no longer pay into Medicare, Medicaid, Social Security, and these programs. So they've shrank the pool of people who are putting money into this, but the pool of people who need these programs has grown. And the government has just said, no, we're not going to work. We're not going to fully fund these things. And that's how we run deficits too. That adds to it, of course. I do want to make one caveat with the numbers I got. Those are subject to change based on what the Senate comes out with and what the House revotes on and what they all agree on. So those numbers could go higher. They could go lower. We don't know. But they can possibly change. And I just think we, as a country, a state, a county, deserve better from our politicians who want to take care of us, or want to care for us, or see us as equals, and not putting us in these little different groups where it's easier to pit us together. And the only way for us to fix that is if we get out our voices and we vote. And that is why we're calling this podcast, YouTube channel, Voices and Votes, Hancock County, Indiana. I'm going to end here, and I'll say one thing. I've talked to a couple people I know. I know a reporter, and she gave me some advice, and she said, you have a voice, use it. And she also said, get used to seeing yourself on camera. So this is my first one. I'll probably be less awkward going forward. But remember, we all have a voice. Let's use them. Let's try to make this world a better place, not just for ourselves, but, for everybody here, and then our kids, our grandkids, what kind of legacy do we want to leave behind? Do we want in the history books, hey, this generation was a generation that decided we don't care, versus this is a generation that decided we care, we want to make things better. As I can see, it's been a little bit over 15 minutes. So I'll leave you guys at the end of this. I will hopefully have another topic sooner than later. And remember, you have a voice, use it. Take care.